selecting the correct size, it is always depending on the patient's weight. There are usually 3, 4, 5 sizes. Incorrect size again leads to a leak or obstruction. So usually while you're opening a supraglottic airway, on that it will usually clearly mention what age, height of the weight of the patient. This is the right mask for. The position is usually sniffing position if possible, but it is not a compulsion that you have to always put it in a sniffing position. Neutral in trauma patient, as there is a risk of cervical spine injury. Jaw should be relaxed. So lubricate the posterior surface. The posterior surface is this surface. So lubricate the posterior surface because this is usually passing through your hard palate. So that's why it needs lubrication. So insert along the hard palate. So sit against the hard palate, insert it, then the soft palate comes, and again there will be a giveaway. Then the laryngeal mask pass through the oropharynx, and then there will be some resistance when it sits on the larynx. So you have to lubricate the posterior surface, insert along the hard palate, pressurize against the hard palate. Once the hard palate is crossed, you will get a giveaway. Then you insert further. There will be further resistance when the laryngeal mask airway reaches your vocal cords. So till then you will be inserting. So this doesn't need any expertise or video laryngoscopy. This can be put even in the ambulance. Paramedical staff are also trained for this laryngeal mask airway insertion. And inflate the cuff if applicable. If that is a laryngeal mask airway or a supraglottic airway device where cuff inflation is required, you inflate it, or else in this particular LMA, there is silicone gel, iGel, self-inflated, self-sealing technology is there that doesn't require further inflation. If you pick up the right sized supraglottic airway device, that will seal it automatically. How do you confirm? You confirm with chest rise while giving bag mask ventilation. The bag compliance also will tell you when there is refilling of the bag. Sonography, will come to that. So the ETCO₂ graph also will tell you whether the position is right or wrong. Improved oxygen saturation. However, if the oxygenation is happening, the saturation starts to improve and maintain. If it is already good, the saturation maintains. The avoiding of the desaturation also will not happen if it is in the right position.